So let's talk about the possible drug treatment of myocardial infarction. All right. If a patient actually has myocardial infarction, which we have already spoken lengthy about it, we said that myocardial infarction is basically the building of what plaques, atherosclerotic plaques, all right, mainly by the deposition of these low density lipoproteins in the blood vessel. Okay, so you're trying to actually look at the possible drug treatment for this myocardial infarction. All right, so yeah. Okay, this is like a illustrative picture. All right, so we have them here. Okay, so for immediate treatment, you have to actually put the patient on oxygen therapy to protect the heart muscles. Okay, so you have to put them on oxygen therapy so that it protect the heart muscles from actually what will I say dying literally from ischemia. All right, then you could use a fluid therapy using what saline. Okay, this is oxygen therapy, and this is what the normal saline that we're talking about. All right, so done with that, that's the immediate treatment. And the next one, you can use analgesics. What is analgesics? Any drug that will basically what manage pain. Then anxiolytics is any drug that will reduce anxiety. All right. So use of strong analgesics such as what IV diamorphine or morphine 10 milligram. They can use diazepam to relieve what anxiety and fear. Okay, so the diazepam here is the anxiolytics. The IV diamorphine, that's the intravenous diamorphine. Right, IV diamorphine means that the diamorphine drug was given what intravenously. Okay, not that IV diamorphine is the name of the drug. No, intravenous administered diamorphine or morphine itself. Right, then we can use thrombolytic and what fibrinolytic therapy. Thrombolytic is basically like if there's any blood clots, all right, you give a drug that will break down the clot, will dissolve the clot. Do you understand? So you say that thrombolytics dissolve existing clots. For example, tissue plasminogen activator, that's a streptokinase, urokinase, and alteplase. All right, and this is you can see this is a clot. To clots. I could see thrombolytic medications to basically like eat up that clot literally. Okay, they could use antiplatelet drugs. Right, we say that all patients with myocardial infarction must be given aspirin. All right, that's aspirin about 150 to 300 milligrams, or you could give them clopidogrel. That's 300 milligram. Okay, and this should be swallowed as soon as possible. Right. So antiplatelet drugs have synergistic effect into thrombolytics. Antiplatelet, they are stopping clotting. Thrombolytic, they are eating up already formed clot. Do you understand? So they act synergistically like that. Then you have antithrombin and anticoagulant therapy. This is basically heparin and its congeners, right? Heparin and its congeners are used to block the formation of new blood clots. All right. So these are the antiplatelets. You could see antiplatelet drugs is aspirin, clopidogrel, ticagrelor, and dipyridamole. Okay. So all these drugs will basically what stop clotting. Okay. And for the drugs that will basically eat up clotting, we have them here. All right, like urokinase, alteplase, streptokinase, and the rest of it. All right. So next, all these are anticoagulant drugs, right? Heparin or warfarin. This is a warfarin tablet. And you're using the ACE inhibitors. These are basically what the angiotensin converting enzyme inhibitors, right? So angiotensin converting, basically when angiotensin is in the body, it will constrict, it will cause vasoconstriction. Okay, so if you inhibit the enzyme that should make the angiotensin, that means angiotensin will be reduced, the levels will be reduced in the body. So angiotensin converting enzyme inhibitors, they prevent what? Ventricular remodeling. That's change in form or function of the heart after myocardial injury. Okay, and thus they will decrease the progression toward heart failure. All right. So angiotensin converting enzyme inhibitors must be initiated within 24 hours of myocardial infarction if the beneficial effect is to be seen. All right. Then you have inotropic agents and what sympathomimetics. All right, you have the beta agonists like dobutamine, dobutamine, and what dopamine. All right, they are used to enhance cardiac function. Used to enhance cardiac function. Then this is the ACE inhibitors. All right, ACE inhibitors basically they will relax the blood vessel, right? Because for a blood vessel to constrict, that means angiotensin needs to be there. So if you are blocking angiotensin, you are relaxing the blood vessel. Then positive inotropic medications, they'll basically increase the strength of heart muscle contraction, all right? Because myocardial infarction is kind of like leading to heart failure. So you're actually like trying to enhance the activity of the heart, okay? They can use statins like what the HMG-CoA reductase inhibitors, and this will basically lower the levels of what low density lipoprotein cholesterol that clog the arteries. You know that the myocardial infarction is primarily due to what this blockage of the arteries. So you are actually looking for a drug that will basically what reduce it. All right. Then you can use statins and what angiotensin-converting enzyme inhibitors improve vascular and myocardial remodeling. Right. They can use antiemetics, and this may be administered in myocardial infarction if nausea and vomiting is present in the patient. Then you can use antiarrhythmic drugs. We said that arrhythmias are very common in what acute myocardial infarction, right? So you want to actually use this drug to improve the whole situation. This is statin, and you can see this is a low density lipoprotein. Okay. Then okay, these are basically drugs that will act to reduce vomiting, right? Drugs that will act to inhibit the vomiting center. And then antiarrhythmic drugs, these are drugs that will basically what correct heartbeat, okay? Because arrhythmias is when there's a distortion in the rhythm of the heart, okay? So you want a drug that will correct the rhythm of the heart back to the lob dub. Do you understand? So that's it, guys, about the possible drug treatment of what myocardial infarction. I'll be seeing you guys pretty soon.